generally speaking, East Asia is a hotbed for a lot of emerging infectious diseases.
According to Public Health Emergency Preparedness Manager Patrick Lujan, infectious diseases currently on the radar for the Asia-Pacific region include dengue, Zika, and Chikungunya viruses, each of which are mosquito-borne and do not have available vaccines. At the first regional conference of its kind, subject matter experts from across Micronesia shared information and best practices on ways to identify, prevent, and stifle possible outbreaks.
It's last year that we came up with this idea, and it was on the heels of Ebola, actually. So, we figured that a lot of the stakeholders need to get together and discuss the same topics because there's a lot of reporting mechanisms in place to kind of have a forecast of potential risks within our islands.
While attention focused on Zika, dengue, and Chikungunya viruses, experts also touched on other regional threats, such as the Middle East respiratory syndrome coronavirus, also known as MERS, in Korea.
As you know, any types of diseases can get to our island within a matter of hours with all the frequency and the travel within our region.
Just last month, 142,000 tourists passed through Guam, and tens of thousands more are expected this May for the 2016 Festival of Pacific Arts. Lujan said while it's almost impossible to prevent viruses from reaching our shores, it is possible to be prepared and to have mechanisms in place to stop them from spreading.
And that's a community-based effort because we get a lot of the data coming from clinics, we get a lot of the data coming from the hospital, and if we see any spikes in any type of sickness or illnesses or whatnot, then there's trigger points along the way, and then that's when we get into it and say, okay, why? Where is it coming from? How do we contain it? How do we control it? How do we prevent it from spreading? So all of those things are in place, practiced on a daily basis.
Participants included local healthcare providers, the Center for Disease Control, and the South Pacific Commission. The conference ends on Wednesday, March 23rd. Reporting for Guam's News Network, I'm Isa Baza.